You don't feel sick. You don't feel weak. You're not in pain. You wake up. You move through your day. You answer emails. You sit in traffic. You stand in line for coffee. Nothing feels urgent. Nothing feels dramatic. But something important may have quietly changed. Not in a way that demands attention. Not in a way that forces you to lie down. But deep inside your bloodstream, the balance between flow and clotting may have shifted. Blood is designed to clot. That's not a flaw. It's protection. If you cut your finger, clotting stops you from bleeding too much. It's a tightly regulated system. Proteins activate. Platelets gather. A soft plug forms. Then, when the job is done, your body dissolves what it no longer needs. But sometimes, that same protective system activates when it shouldn't. A clot forms inside a vein or artery without an obvious injury. And when that happens, the first signals are often subtle, sudden, easy to dismiss. Today, we're going to walk through 7 early symptoms that can appear quickly when a blood clot forms. Not to create fear, not to self-diagnose, but to understand what's happening inside the body and why awareness matters. First, let's talk about sudden swelling in one leg. Inside your veins, blood is constantly being returned to the heart. In the legs, this requires pressure changes from walking and tiny one-way valves that prevent backflow. If a clot forms deep inside a vein, often in the calf or thigh, blood cannot move upward efficiently. Pressure builds behind the blockage. Fluid begins to leak into surrounding tissue. The leg, or part of it, may look visibly swollen compared to the other side. A common myth is that swelling must be dramatic to matter. In reality, early swelling can be mild. It may feel like tightness in the calf, a sock leaving a deeper mark than usual, a shoe feeling snug on one side. People who sit for long periods, travel long distances, or are recovering from surgery may notice this more. Hormonal changes, pregnancy, certain medications, and dehydration can all influence clot risk differently in different people. Age and underlying vascular health also matter. Second, warmth in a specific area. When a clot forms, the body responds with inflammation. That inflammation increases blood flow to surrounding tissues. The skin over the affected area may feel warmer than the opposite side. This warmth is not a fever. It's localized. It may be subtle. When you place your hand over one calf and then the other, you might notice a difference. The myth here is that inflammation must be visible as redness or rash. In early clot formation, redness may be minimal. Warmth can be one of the first physical cues. Third, unexplained pain or tenderness in the calf or thigh. Pain from a clot is often described as a deep ache or cramp-like sensation. It may worsen when walking or flexing the foot. This happens because pressure builds in the vein, stretching surrounding tissue. Many people assume it's just a muscle strain, and sometimes it is. The body is not fragile. Muscles get tight. We overuse them. But what reframes this symptom is context. If the pain appears suddenly, without a clear injury, and especially if it's accompanied by swelling or warmth, it deserves attention. In controlled human studies, pain perception varies widely depending on stress hormones, sleep quality, and nervous system sensitivity. Someone under high stress may experience more intense discomfort. Someone with reduced sensation, such as in diabetes, may feel less. Fourth, sudden shortness of breath. This is where physiology becomes more serious. If part of a clot breaks loose, it can travel through the bloodstream to the lungs. There, it may partially block blood flow. Oxygen exchange becomes less efficient. The body responds quickly. Breathing becomes faster. You may feel like you can't get a full breath. It may come on suddenly, even at rest. A common assumption is that shortness of breath must follow heavy exercise or anxiety, and often it does. But when it appears unexpectedly, especially with chest discomfort or a racing heart, it signals that circulation and oxygen delivery have changed. Fifth, chest pain that changes with breathing. When a clot affects the lungs, chest pain can feel sharp and worsen with deep breaths. This is different from the heavy pressure often associated with heart-related pain. It may feel like a stitch in the side that doesn't go away. Inside the body, reduced blood flow creates localized inflammation in lung tissue. The lining of the lungs becomes irritated. Each breath stretches that lining, triggering discomfort. The myth is that chest pain must be crushing to be serious. Early clot-related chest pain can be subtle, especially in younger individuals. Fitness level, pain tolerance, and hormonal differences all influence how it's perceived. Sixth, a rapid or irregular heartbeat. When oxygen delivery drops, even slightly, the heart compensates. It beats faster to circulate what blood it can. You may feel palpitations, a flutter, a sense that your heart is working harder than the situation requires. In metabolic research, we see how the autonomic nervous system responds quickly to changes in oxygen and blood pressure. Stress hormones like adrenaline increase heart rate within seconds. The myth here is that a racing heart always means anxiety. Sometimes it does, but sometimes it's a compensatory response to internal changes you cannot see. Seventh, sudden unexplained fatigue or lightheadedness. When circulation is disrupted, tissues may receive slightly less oxygen. The brain is especially sensitive to this. You may feel faint, foggy, unusually tired without a clear reason. This doesn't always mean collapse. It can feel like a sudden dip in energy, a need to sit down. We often assume fatigue must come from poor sleep, overwork, or diet. And often, that's true. But when it appears abruptly, alongside other symptoms, it reflects a systemic shift. It's important to say clearly, not every cramp is a clot. Not every breathless moment is an emergency. The human body produces sensations constantly. Most are benign. But blood clot symptoms often share two characteristics. They appear suddenly, and they don't fit your usual pattern. Why do clots form in the first place? 3 broad physiological shifts increase risk: slowed blood flow, increased clotting tendency, and injury to vessel walls. Long immobility slows flow. Dehydration thickens blood slightly. Hormonal changes, including pregnancy and certain contraceptives, can increase clotting proteins. Surgery and trauma affect vessel integrity. Chronic inflammation, smoking, and some medical conditions alter the balance further. In fasting-adapted individuals or those under high stress, changes in hydration and stress hormones may subtly influence circulation. That does not mean fasting causes clots. It means physiology is interconnected. Electrolytes, movement, and hydration all matter. Adaptation is key. The body thrives on gradual shifts. Sudden extreme changes in movement, stress, or hydration can temporarily alter internal balance. This is not about fear. It's about pattern recognition. Blood flow is like traffic on a highway. Most days, it moves smoothly. But if there's an obstruction, pressure builds behind it. Cars don't stop instantly. They slow. They stack. The system compensates until it can't. The earlier the obstruction is recognized, the easier it is to redirect flow. There are also people for whom this conversation is especially relevant. Those recovering from surgery, individuals with a personal or family history of clotting disorders, pregnant or postpartum women, people with cancer or certain autoimmune conditions, those on specific medications that influence clotting, and individuals who have been immobile for extended periods. This awareness is not meant to replace medical evaluation. It's not meant to self-diagnose. And it's certainly not meant to ignore other explanations. It's also not about assuming the worst. Many symptoms have simple causes: muscle tightness, anxiety, dehydration, viral illness. The difference lies in combination and timing. A single symptom in isolation is common. Several appearing suddenly together is less common. Responses vary between people. Age, hormone levels, stress resilience, metabolic health, and genetics all influence how a clot presents. Some experience dramatic symptoms. Others notice only subtle shifts. And importantly, prevention is not about extremes. It's about supporting circulation gently and consistently. Regular movement, adequate hydration, respecting recovery after surgery or illness, managing chronic stress, listening to your body's patterns. This approach is not for everyone in the same way. People with bleeding disorders, those on blood thinners, pregnant individuals, and anyone with complex medical conditions should always follow personalized medical guidance. The goal is informed awareness, not self-treatment. Your body rarely shouts first. It whispers. It adjusts. It compensates. The question is not whether you should worry about every sensation. It's whether you understand the signals well enough to recognize when something feels different from your baseline. You don't feel sick. You don't feel weak. But sometimes, something important has quietly changed. Awareness is not anxiety. It's literacy. It's understanding how circulation works, how clots form, and how early symptoms can appear suddenly but subtly. In the next video, we'll explore why some people develop clots under similar conditions while others never do, and what that difference actually means.